Patty Stalker here from WestfordCAT, and welcome to another edition of Health Beat. As many of you know, October is Domestic Violence Awareness Month, and we thought it would be a good idea to gather together several members of the community who are dedicated to raising awareness about and remembering the victims of domestic violence, as well as talking about some of the local resources available to those in need of help. Today I have with me State Representative James Arciero, as well as several members of the Westford Coalition of NonViolence, founding members Joanne, Derr, and Reppucci, Westford Public Health Nurse Gail Johnson, and Town social worker Alison Christopher. Hello, guys, welcome.
Hi, thanks for having us today.
So Gail, why don't we start with you? Tell us a little bit about the coalition.
All right, well, Westford Coalition for Nonviolence started roughly over 10 years ago when there were two murders that happened in Westford, about a month apart from one another.
I remember that.
I was not the public health nurse at the time during this violence. But when that happened, one of the cases where a husband shot his wife and killed her, and he attempted to kill himself, but he survived and went to jail and left his children behind. And then also another husband shot at his daughter and killed her. She was in high school, and shot at his wife, attempted to kill her, and he shot himself and he died. So, and that spawned the coalition from Jody Ross, who's the town manager, brought together this coalition with all the stakeholders at the time and brought together to come up with what a plan would be. The organization became very large at that time. And then Sandy Collins, our retired health director, took over. And when she retired 3 years ago, or 3.5 years ago at this time, I then took over as chair of this committee. It has evolved since the beginning, about a decade or so, where our committee members, actually the coalition, it's not a committee, it's a coalition. I may use that interchangeably, but it is not a committee, it is a coalition. And it is now a much smaller group. But our main goal in this coalition is really to raise awareness of domestic violence. And we meet monthly, although there was a hiatus during the COVID time where my job became overwhelmingly busy with COVID. But we are now back, and I'm very grateful to do that, bring our coalition members back. And so I am so excited that we came together today, and so we can bring some awareness to, in regards to domestic violence. And so I did want to read the mission statement from all of us, and apologize. It's on our New Growth pamphlet. So I just want to read that. It's promoting safety and peace in Westford through ongoing conversations and awareness-raising activities, reducing isolation, and fostering community connectedness. And we do have a brochure that we are or booklet ready. We're ready to go with that and have it printed by Neshoba Tech, and the pandemic hit, and that stopped us in our track, and we were unable to then finish it. We're hoping to get that completed. We do have a pamphlet that we do have available and will distribute in our community that gives us great information on resources and information on what domestic violence is. And that will be distributed in our community that can be found. And one last thing I just want to say is this committee is from different people that are part of this coalition, that from victims to residents, stakeholders in this community, and we are always willing to accept more people into this coalition who want to have input and also to help us spread the word of domestic violence. And we'd be happy to accept anybody who's willing to want to give as much as they want or as little as they want, honestly, to provide any feedback would be wonderful. So thank you.
So, Joanne, you wanted to remember those who have lost their lives to domestic violence over the past year. And you have a list of names that you would like to read. I think that would be a wonderful tribute.
Yeah, I have a list from the Jane Doe Inc. Compiles that list and keeps it on an ongoing basis. And one thing I wanted to say before that is in terms of how I got involved in this, is that when the murders happened in our town, I had that reaction that a lot of people have when something tragic and shocking and violent happens, which is, in this town, really?
I think we all thought that, yes.
Exactly. And so I sought out a group of people to help make meaning of it for me and for my family. How could this happen? What does it mean? What are the warning signs? How could we educate ourselves and then the community? And the coalition has very much been that source of information and resources and support, with folks from Alternative House and the social workers that we have, and people from the school system, and lawyers, and Jody Marchand, herself a victim. I mean, just the listening and the support and the learning from each other has been phenomenal. Grateful to Jim for being here today. He always comes out and supports us in what we do. So to Gail's point, it's not just a how do I teach other people, it's how do I learn for myself? And that's where a lot of this journey really started and continues for me and for the rest of us. So thank you, and thank you, Gail, for continuing to lead us.
Yeah, I think there's, we also have to worry about the stigma attached to it. I think a lot of people, a lot of women are afraid to talk about it. They feel that they are somehow weak, or they're embarrassed that they got themselves into a situation, I think that that's something when you're talking about domestic violence awareness, is we have to get rid of that stigma.
Absolutely. That's one of the things that all the women who have spoken at our events have talked about, is the embarrassment and humiliation of being in that situation. And so they don't speak up, and they don't seek out resources. Why do we have a pamphlet and a brochure instead of blasting it all over social media?
Absolutely.
See where these women are. And we try to have them pick up something and be able to take it and not rely on social media or their computer, which can be monitored. So a lot of fear and a lot of hesitation and a lot of real risk, and lives that are lost as a result of people not getting the support and resources they need. Absolutely.
Jim, would you like to talk a little bit about, Joanne, before you read the list of names, Jim, would you like to talk a little bit about the stigma and how you're speaking out and helping those throughout the Commonwealth?
Well, thank you. It's been an honor to be part of this crew and this group over the years, making sure that we find ways to educate people, provide awareness, and end the stigma to domestic violence. First, I would like to thank Gail Johnson, our public health nurse in Westford, and Alison Christopher of the Westford Council on Aging, and our town social worker, Joanne Derr, and Reppucci. This makes it so much easier for me to be here because you guys are all my friends and we've worked together for so many years. I just appreciate all the efforts and leadership in putting this event together to address the impact of domestic violence in our society, in our families, our communities, especially during this pandemic. And I want to thank all who are joining us in this endeavor as we recognize October as Domestic Violence Awareness Month. As you all know, domestic violence was seen far too long as a sort of a lesser offense. It was considered to be a private family matter in some cases. Victims were often sent home from the hospital without intervention. Children were left to suffer in silence, and as a consequence, abuse could continue for years, and sometimes for decades. In many cases, this violence could ultimately end in the murder of a woman, a child, an entire family. we have come incredibly long way since those dark days. We've changed the laws on Beacon Hill. We've continued to have sort of a grassroots approach to ending the stigma and to awareness. And just as importantly, we've changed the minds and changing the stigma in the way that people think about domestic abuse. Survivors have had the courage to come forward and tell their stories, which oftentimes is, so very hard to relive and to speak about. And by doing so, they can change lives and empower survivors and advocates to make a difference. The facts about domestic violence are clear. Nearly 1 in 3 Massachusetts women have experienced rape, physical violence, and/or stalking by an intimate partner. 1 in 3 women and 1 in 4 men have experienced some form of physical violence by an intimate partner. Intimate partner violence accounts for 15% of all violent crime. 72% of all murder-suicides involved are by an intimate partner, and 94% of the victims of these crimes are female. On a typical day, domestic violence hotlines receive approximately 21,000 calls. That's nearly 15 calls every minute. In a single day, almost 1,800 victims were served by Massachusetts domestic violence programs. These statistics, both here in Massachusetts and throughout the country, remind us, they inform us about how cruel and menacing, domestic violence can be, because it happens at home, where you should feel the safest and the most secure. And that's the scary thing. It's unacceptable. We need to continue to embrace, these campaigns really to spread awareness and to end the stigma and be advocates for and supporters of our domestic abuse survivors. Lastly, I'd be remiss if I didn't thank my good friend Jody Marchand, who through her tireless efforts have made domestic violence so relevant to the Westford community, along with the help of people on this call today. Not only has she provided courage and a voice to many survivors in our town and across the state, but she's made, myself, I think, a better state representative, understanding these issues, understanding the pain that families go through and what we can do to help. It takes a lot of courage for Jody going through that ordeal to every day look to make this world a little better, a little brighter, going through just traumatic tragedy that you just couldn't imagine. Jody is a hero. She is someone that we look to on these issues to really be our crutch as well. When we just can't imagine how she has become such a warrior for this cause. It certainly is something that we all look up to. So I would just encourage people that are listening today to continue to tell your stories. It's important work that you do to tell your stories, and that others are here to assist you and to continue on this great work to end the stigma and end domestic violence in Massachusetts and this country. So thank you for the opportunity to say a few words. And I just want to salute the great work that everyone here does.
Thank you, Jim. And thank you for mentioning Jody Marchand. She's come in to the studio on numerous occasions at WestfordCAT to talk about her own personal journey and story. And she recounted the incident in detail. And I was happened to be in the control room at the time and was crying. I mean, brought to tears. And the fact that she can tell it so boldly and so unabashed, it really is a testament to the woman that she is. So thank you for mentioning her.
Absolutely. And, I think people forget the leadership that she's provided, not just for survivors and not just on the issue, but she, last year, I had myself and Congresswoman Lori Trahan had the opportunity to salute some of her work at the Moms Demand Action annual meeting that took place in Westford. She had folks joining that organization just by hearing her that day. I know that my wife's a member of Moms Demand Action as well, and there was just a tremendous amount of people that were there that day that were moved to tears by her story, Patty. So you're right, and it's because of survivors like Jody that other people each and every day are able to live a better life.
Yep, modern day warrior.
Absolutely.
Let's talk with you, Alison, about some of the resources available to people in town that may be suffering from domestic violence.
Sure. You know, as the social worker at the Council on Aging and the town social worker, I see people regularly who are in these situations, who are surviving every day through very difficult circumstances around domestic violence. And I think what I see so often is the fear of reaching out for support or information. I think can be really scary to take that first step. And I would like for people to have the information and hopefully be able to take the first steps to reach out for support before a crisis is evolving. It's so much easier if folks can gain knowledge and information and be educated about the cycle of violence and the possibilities for the future and safety planning, and to just have the resources before they feel like they need to actively do something right now. So, you know, I'm always available to consult with people if they feel that they're in a situation that's difficult. I've had people come to me and be concerned that they shouldn't call one of the hotlines that I've given them because they are only experiencing emotional abuse or controlling behavior from a partner. And I want people to know how relevant those issues are to ultimately really severe outcomes of domestic violence situations. Domestic violence can take many, many forms, and it can escalate over time. So what people might think is a less severe example of what they're going through is no less significant. If it's just emotional or just financial or controlling behavior, those are all things that are very serious. So I want people to know that they can call me. We have a domestic violence expert in Detective Nicoletti through the police station. She handles a lot of those cases on a regular basis. But we also have really good hotlines that are available 24/7 to people. Obviously, if someone is in an imminent danger emergency, we're going to want them to call 911. But there are many times that people are experiencing domestic violence in various forms where they just need to talk to someone at any hour of the day and get some advice or do some safety planning or think about their next move. Or it may be that they've decided that they need to find a shelter bed for someone experiencing domestic violence and their children. And these hotlines are an amazing resource for that. So I want people to know about the SafeLink hotline in Massachusetts, which is statewide, 24/7, toll-free domestic violence hotline. It's for anyone experiencing any type of domestic or dating violence. And the number there is 877-785-2020. They also are the clearinghouse for knowledge of all of the shelter bed availability in the state. But you can call them for anything related to domestic violence. There's also a national domestic violence hotline that's been offering support and assistance throughout the pandemic and long before. they are at 800-799-SAFE. And Alternative House, which is local, has a hotline at 888-291-6228, which is also a 24-hour crisis line. So, you know, keep those numbers somewhere that they are very safe and not accessible to the abuser. Be really careful using websites. These places have great websites, but make sure that you're doing it from a safe computer, that you understand how you can exit, and you're using a device that someone cannot trace where you've been, because you don't want to do anything that's going to put yourself in further danger. But I'm happy to let people use my computer. I'm happy to do searches for people. And have confidential phone calls with them, or meetups. One other thing I'd like to say is that specifically for seniors, which is people 60 and over, the Executive Office of Elder Affairs has a 24-hour hotline, which is for elder abuse. And that can take many forms. It may be abuse of an elder that is not related to domestic violence, but it includes intimate partner and family abuse, physical, emotional, verbal, financial. And anyone who has a concern about a senior can call that number and make a report to 800-922-2275. So I hope that people will keep, you know, this information handy for when they may need it in the future, and you can also share it with friends or relatives, or call on behalf of those people without sharing their confidential information, but just get advice for someone that you know who might be struggling and could use it. I hope that's helpful for folks.
It is, Alison. Thank you. And I want to get to Pat Reppucci, who is the liaison between the Council on Aging and a senior center in town and the coalition, the Westford Coalition for Nonviolence. But I did want to touch on a couple of things that you said, Alison, before we get to Pat. When you mentioned about, you know, a computer and, you know, fearful that someone can trace back their steps and where they've been. You know, one thing to mention is to always clear the cache and, you know, your search history. Keep that in mind. You can also search on Google Incognito. And that's, you know, a bit of helpful information maybe for those out there. Also, during COVID, there's been a rise in domestic violence. Obviously, as people we're all kind of, you know, having anxiety over this, just all of us. But for those that are in the situation of domestic violence, being stuck at home, not having the ability to go to work and to escape, you know, it's on the rise. And so I'm really glad that we are all here together to share the resources available. And another thing I wanted to mention was thank you for talking about the emotional abuse. It's not just physical. And Jody Marchand is someone that has talked about that. It was emotional abuse for her, and it ended in, you know, her losing her daughter and, you know, being shot herself. So thank you for bringing that up, Christopher. Alison, sorry, such a wonderful point. So Pat, thank you. Pat, let's talk a little bit about what your role is as a liaison.
I did spend some time updating our handbook, so I'll just touch upon that briefly, because we've broadened the scope of, you know, who is abused. Is it always women? So we've added verbiage that covers LGBTQ and changed some of the language there to show that, you know, it runs across the board, all incomes, everybody. And I think people are surprised at that. So moving on to seniors, what you find, or I have found personally, are older women who have never spoken about what has happened to them in their past lives. And sometimes, I don't know if it's just age, they're able then to share experiences, but they were the silent group that never spoke up because of the stigma. So all of a sudden, because we have put all this information out there, you are hearing seniors talking about what's happened. So it's been interesting to hear those stories, and probably I send more people Alison's way for information or give them the information that's in our handbook. So we have at times had booths with the information, and we have been able to spread that. And even if we touch one person in some of the outreach work we do, I think it's worth it.
Thank you, Pat. Joanne, there was something that you wanted to mention?
We've mentioned Jody a couple of times. She's also one of our founding members of the coalition and somebody who's helped to teach us, and we've also been there to support her, I believe. And one of the things that, talking about being a hero and a warrior that she's taken on in the last couple of years, and it's been super helpful here in Westford, is speaking with the high school kids. So the other end of the spectrum, Pat's talking about the seniors and the stigma of speaking up, and then you've got the high school kids who have experienced verbal abuse and controlling behaviors on dates for many years and might not see that as a warning sign for potential domestic violence. And so she's been educating the younger folks about that and going out to colleges and universities as well. So she's very much part of our coalition, as is the support we provide, Live for Live, and the support that Live for Live provides back to us. So that's been a wonderful part of this work.
You mentioned colleges. I have two sons that are in college. I have a son, a bioengineering major at Endicott College, and my younger son's a political science major at Suffolk University. And both of those colleges, during their orientation program, talk about resources available for students regarding domestic violence, whether it be emotional or physical. And they have workshops for the men and the women, both, to sort of learn about it and realize what it actually is. So, I applaud colleges also for realizing that this is, a real issue. And especially, a lot of times these young women, it's their first time away from home, and obviously. And I just thank you for mentioning that about Jody going to colleges and universities. And again, I applaud the colleges for stepping up.
Yeah. May I say something?
Yes, absolutely.
Thank you. In behalf of Jody, who has taught me also so much in these many years I've been doing chairing this coalition, one of the things that we talk about so much is, besides the physical, sexual, emotional, psychological, verbal, financial, spiritual abuse, neglect, bullying, and gaslighting. These are the things we discuss in all levels, whether we talk about the elders or we talk about children in abusive homes. We run the gamut, and we try to raise awareness for each cohort. And one of the things that Jody has mentioned many, many times is younger people have a harder time identifying abuse because it's very difficult to identify it when you have a boyfriend who texts you, as she always says in our meetings, texts someone 50 times a day. And you think how wonderful, they love me. Look at this. Look at how much they love me. They text me all day long. What are you wearing? What are you doing? Who are you with? And that could be misconstrued as, wow, this guy is really, thinks I'm great. But in fact, that is abuse. And she's raised that many, many times that's happened, and really wants people to be aware at all ages that abuse comes in all different forms and to all different people. And it happens to boys and men, just, too, in addition to just women, but more often it is women, as Jim had mentioned. It is a higher percentage of women than men, but men should be included as well.
It's the controlling is what you're saying. Yeah, control. And oftentimes they isolate them. They start pushing them away from their friends and their family, and they become isolated and they have no one to talk to. So
and that's
yes.
very subtle. It's
Yes.
a very subtle isolation period. Mm-hmm. You don't know it's actually happening, and it's slowly happening until you are completely isolated from your family, relatives, and your friends. Yes. Mm-hmm.
So is there anything else that any of you would like to mention before we wrap and Joanne reads the names of the victims from the past year?
I have just one comment. In my prior volunteer life, I think my eye-opener for some of this was when I did foster care review. I found it heartbreaking. It's the toll on children. And I think people don't realize children might be standing there, hiding around the corner, and the depth of disruption to their lives and socially, emotionally, and every other way. I think for them, you know, we need to keep going on all of the work that we do.
Thank you, Pat, for mentioning the children that see all of this. It must be devastating for them.
I do want to add one more thing. We're updating. I'm working with our IT group to update our website, and I'm hoping that we will have that up sooner than later. And we will add all of the resources that Alison has just mentioned. Plus, Pat and I have been working diligently in trying to get this brochure out. And in that brochure booklet, we will have all the resources in there as well. And we'll add those also to the website, and more to come on that in hopefully the nearest future.
Great,
and we also have a Facebook site too.
Great, thank you, Gail. Okay, so Joanne, let's pay tribute to those who have lost their lives over the past year. How many names? How many people, I should say, not names. How many people?
So the way that the Jane Doe Inc. JDI tracks this is the number of incidents and victims, and there were 17 victims in Massachusetts just between last October 1st and the end of September. So those are the ones that we're going to be talking about. 23 deaths overall. So 17, and I've got 14 names to read out because some are not able to be identified for one reason or another. Names are not released.
Okay.
Okay.
Yep.
Jennifer Vasquez Rivera, Deirdre Zakari, and 3 children, ages 11, 9, and 9. Jason Swedberg, Mary Fairbairn, Jamie Ammons Madre, Shaniki Roldan, Charlie Cook, Carla Rodriguez, Sandra L. Kumar Cornfield, Mardietta De Boyes, Kathleen McLean, Amber Pereira, Migdalia Perez, and Megan McNeil, age 27.
Thank you. So I want to thank all of you for getting together this morning. I know we sort of were kind of threw it all together, and it's just a wonderful resource and you know, way for people to learn about domestic violence and know where to get help. And I'd like to thank each and every one of you: Gail Johnson, Joanne Derr, Jim Arciero, Alison Christopher, Pat Reppucci. You're all doing terrific work, and I appreciate you all being here today.
Thank you.
Thanks, Patty, for having us.
Thank you to all of you.
So that's it for this edition of Health Beat, and thank you for watching. I'm Patty Stalker for WestfordCAT.